Welcome to the Oklahoma State University College of Osteopathic Medicine training video on the Ankle Brachial Index, the ABI, or otherwise known as the Ankle Brachial Pressure Index, the ABPI. The ABI is utilized in the diagnosis and monitoring of peripheral artery disease, a disease that impacts about 8 million people in the United States, though unfortunately only about 30% have been screened and diagnosed. First, a brief overview of the pathophysiology of peripheral artery disease. A blood vessel that is patent, open without any occlusions or atherosclerosis, allows for blood to flow easily. Over time, atherosclerosis develops due to chronic inflammation and activation of the immune system within the arterial walls. Lipids deposit within this region over time, including the blood vessel. A stenotic femoral artery reduces blood flow to the lower extremity, thus causing peripheral artery disease. To assess the severity of peripheral artery disease, an ABI or ABPI ratio is calculated by measuring the ankle systolic and the brachial systolic blood pressures. Now let's examine how the ABI measurements are taken. To perform the ABI calculation, you will need a simple handheld vascular Doppler machine, some ultrasound gel, and an appropriately sized blood pressure cuff. Please allow me to introduce Dr. Amanda Kane, a board-certified emergency physician and assistant professor at the Oklahoma State University College of Osteopathic Medicine. To begin the assessment, your patient should be lying in the supine position for approximately 5 to 15 minutes before the examination. This allows the blood pressure to normalize for the most accurate readings. Ideally, patients will not have used tobacco products for 30 to 60 minutes before the exam. Once your patient is lying supine, relaxed, and has consented to the screening test, we can begin our blood pressure assessment. To determine the brachial systolic blood pressure, use the handheld vascular Doppler. Next, secure an appropriately sized blood pressure cuff around the arm, taking care that you can still access the brachial artery and you're able to locate the brachial pulse with your fingers and the patient's antecubital fossa. Then, apply a generous amount of ultrasound gel over the brachial pulse. Slowly adjust the Doppler probe to obtain an audible signal. The best results are obtained by holding the Doppler probe at a 40 to 60 degree angle toward the heart. Proceed by inflating the cuff until the Doppler signal disappears. Usually, 20 millimeters of mercury above their normal blood pressure is sufficient. Then gradually release the pressure valve until the signal returns. Record both systolic readings for the right and left arm. The higher of the two readings will be the denominator for our ABI calculations. Now let's measure our peripheral systolic pulses. The two pulses of interest are the dorsalis pedis pulse, and just posterior to the medial malleolus is the posterior tibial pulse. It may be normal to be unable to feel the dorsalis pedis pulse bilaterally, but you should always be able to palpate a posterior tibial pulse. A non-palpable posterior tibial pulse is always an abnormal finding. With your fingers, locate the dorsalis pedis pulse, and then the posterior tibial pulse is located posterior to the medial malleolus of the foot. Ensure the blood pressure cuff is secured and around and above the ankle. Then apply a generous amount of ultrasound gel to the dorsalis pedis pulse. Once again, locate the dorsalis pedis pulse, holding the handheld Doppler probe at a 45 to 60 degree angle toward the heart. Slowly adjust the Doppler until you can appreciate the loudest pulse sound. Then inflate the cuff until the Doppler signal disappears. Gradually release the pressure valve until the pulse signal returns. Be sure to take note of the pressure at which the pulse signal returns. Repeat the above steps for the other foot and record the highest systolic pressure measurement between the dorsalis pedis and the posterior tibial pulse signals. The final step is to calculate the ABPI. The ABPI is calculated separately for both the right and left side. To calculate the ABPI, divide the highest ankle systolic blood pressure obtained on each side by the highest overall brachial systolic blood pressure. Here I will show you an example of how to calculate an ABPI. For the brachial systolic pulses, we measured a systolic blood pressure of 142 for the right brachial artery and a systolic blood pressure of 138 for the left brachial artery. For the peripheral systolic pulses, we measured a systolic blood pressure of 110 for the right dorsalis pedis pulse and a systolic blood pressure of 102 for the right posterior tibial pulse. Lastly, we measured a systolic blood pressure of 120 for the left dorsalis pedis pulse and a systolic blood pressure of 116 for the left posterior tibial pulse. Once again, the ABPI is calculated separately for the left and right side. The highest ankle systolic blood pressure on the right side is 110. This will be divided by the highest overall systolic blood pressure of 142, which will equal 0.77. Next, the highest ankle systolic blood pressure on the left side is 120. This will be divided by the highest overall systolic blood pressure of 142, which equals 0.85. Our ABPI measurement on the right side indicates possible moderate arterial disease. Additionally, the ABPI measurement on the left side indicates possible mild arterial disease. The ABPI readings may be utilized, per evidence-based medicine, to diagnose and monitor peripheral artery disease. Thank you for watching the preceding program.